My name is Josef Zoldos. I'm one of the founders of Arizona Center for Hand Surgery, 8-physician hand practice. We deal with any condition of the hand, wrist, or elbow. We work in an extremely busy practice. There are many level 1 trauma centers in Phoenix, Arizona, and we cover the majority of them. Our current modalities that we have are X-ray, fluoroscopy, and CurveBeam CT that was recently acquired, and it's part of the service that we provide. And it's usually for carpal or distal radius conditions where plain X-rays did not provide you the amount of visualization that you needed. The biggest example is a comminuted intra-articular distal radius fracture. We frequently treat those currently with volar plate fixation. Well, it's very difficult to get imaging post-operatively that adequately shows that the hardware is or is not within the joint. And a lot of times when the articular components are quite comminuted, those patients are sore. And me as a physician, I also want to confirm that the hardware is outside of the joint. The CT scans are the gold standard for managing certain conditions, like for scaphoid, to diagnose scaphoids and also to diagnose healing of scaphoids. Prior to having our own CT in our practice, we would send patients out and the CTs would be done at an outside facility, and they would frequently come back without the disc. Just like I want to see the X-rays, I don't just want to see the report. And truthfully, a lot of times the report doesn't help, and having them done in our practice eliminates that whole issue. Patients love it. They like not having to go to an outside facility to get their images done. They like being able to sit down with the physician and see the images three-dimensionally manipulated. It helps us educate our patients as to what their diagnosis is, and it helps us educate patients with respect to the treatment options that we're recommending. Although there are some acceptable levels of radiation exposure, essentially less is better. One of the comforting things about CurveBeam is it probably has 1/15 or 1/20th the amount of radiation exposure than a conventional CT scan. It's slightly more than a plain X-ray, and that is quite significant. You know, I'm a hand surgeon. I try to have a busy clinical practice. CurveBeam allowed us to install this and really kind of hold our hands through the process. We assigned one of the medical assistants in our office to kind of manage the project. And between CurveBeam and our MA, they were able to essentially get it up and running with very little physician input. All the documentation, all the policies and procedure manuals the company helped us with. I think for anybody with a medium or certainly a multiple provider practice, it is almost a no-brainer to have this in your practice. There's a paradigm shift in medicine, and we are here to provide service to our patients. CurveBeam allows us to get one step closer to providing a better service, and I think that people who utilize it will have a competitive edge over their competitors.